When we've come to the point that a male sling seems to be the best option for patients, there's been a number of factors that have been considered. One of the most important is patient desire as far as what's going to be considered a good outcome. Additionally, we want to know what kind of mechanical failure rate would patients be okay with in the long term if we chose to use a sphincter device that was actually a cuff that closed over the urinary channel. And finally, we want to know, what factors go into a patient's day-to-day life. How stressed are we going to put this area under pressure? Are you a heavy weightlifter? Is that something that will create an issue? Is there long periods of time before you can go empty your bladder in such a manner so that the bladder does tend to get overfull? So there's a number of ways we have come to this conclusion. But ultimately, when we've come to this conclusion, we've realized that the incontinence component is affecting quality of life so much so that it does make sense to proceed with surgical treatment. During the male sling placement, we do have patients asleep. So for the patient, it's a very short procedure, and one that when they wake up, often it seemed like a matter of minutes. The procedure itself is done in the operating room, and what we're going to do is cut down to where the portion of the urethra is that we need to resuspend and provide a backing for. When we get to that portion of the urethra, the male sling will be placed, and under direct visualization, looking through what's called a cystoscope or a small camera in the penis, we're able to verify that we are moving things into the appropriate position exactly where we want them. Once we're happy with that, everything is fixed into place. We're able to close up our incision, and the patients are ultimately taken to the recovery unit to recover. Most patients are then able to go home the same day without much issue, and the key is we want to make sure they can urinate before going home. Most patients following male sling placement are going to go home the same day. It's a rare occasion where we do keep men overnight, and usually it's from other medical issues that are going on or to ensure that there's somebody to stay with them at home. But the majority of men will get to the recovery unit, stay in the recovery unit approximately 1 to 1.5 hours, and once they're able to tolerate a little fluids, a little liquids, their pain's under control, we'll head home after that. Prior to surgery, determining which clearances are necessary really depends on what medical problems the patients have. For most patients, we will do an EKG or an electrocardiogram of the heart. We'll do some blood work as well as a chest x-ray to make sure the lungs look clear. If there are other heart issues, if there's concern with recovery, recurrent concern for extra bleeding, those are things that we will then proceed to get extra clearance prior to going to the operating room. Patients should arrange for transport following the procedure. Following the procedure, it's important that we have somebody stay with you for approximately 24 hours. You will need somebody to drive you home that same day. And why we have somebody stay with you is because if you were to take a pain medication, fall asleep, wake up, and not realize that you're just taking the pain medicine and take it again, now the combination of that extra pain medication and the anesthetic can become problematic. So it is very important that we have somebody drive patients home, as well as stay there with them for approximately 24 hours after surgery. Most patients don't have too many instructions they need to follow in the days leading up to surgery. One of the keys will be to look at the medications and make any changes we may need there, particularly to limit bleeding risk. Other than that, we don't ask patients to shave beforehand. In fact, it's kind of a tough area to get shaved anyway. And the antibiotic wash isn't typically necessary for the male sling because there is a lower infection rate because of the mesh material and the fact that the body's able to grow into that material. Most patients will not need to alter or change the medications they take prior to surgery. The exception to this will be medications that may increase the risk of bleeding, things such as warfarin, Coumadin, Plavix. Now, I do encourage patients to continue to take their aspirin throughout surgery, but as far as the blood thinners specifically, it's important you ask us or your cardiologist prior to changing those medications so we can determine what's the best course of action. There are not typically any eating or drinking restrictions for patients. However, we do ask that patients not eat or drink anything following midnight the day of their surgery. There is an exception to this where patients may be allowed to take sips of water to take their medications, or some patients may be allowed to have black coffee or clear liquids or Gatorade about 2 to 3 hours prior, assuming it's no more than about 20 ounces. Keep in mind, if you are going to have black coffee, it needs to be black coffee. Anything added to it can create a problem and have the surgery canceled. There's not much patients need to bring to surgery the day of a male sling placement. The vast majority of those patients are going to go home the same day, and therefore really the only thing that they would need to bring would be their CPAP machine, which may make it easier for them to recover and get rid of some of the anesthesia in the post-operative recovery unit. If patients are going to spend the night, again, bringing their CPAP machine is very helpful. Additionally, having a phone in case you want to contact other individuals and a phone charger can be very useful too. We do not need patients to shave prior to surgery. This is not the easiest area for them to shave to begin with, but additionally, any early shaving can allow bacteria to get in any of the little crevices or nicks that can occur. Then when we go to prep the skin, we may not be able to adequately clean that area as well as we could if we shaved immediately at the time just prior to surgery. So patients do not need to shave, and in fact, we'll take care of that in the operating room. The day of surgery for patients is relatively straightforward. Patients will come in that morning. They will generally be weighed, be asked when you last ate or drank anything, confirm your name, your date of birth, where you want our prescriptions to go after the procedure. After all that's occurred, patients will change into a gown. Sometimes we'll be requested to wipe down with an antibiotic kind of towel to minimize bacteria along the body, and then generally an IV will be placed. The IV will allow us to give you an anesthetic as well as start some antibiotics prior to the procedure. I'll come and talk to the patients. We'll answer any questions that are there, make sure that everybody's on the same page for surgery, and then we'll head back to the operating room. You will have a chance to talk to the anesthesiologist before going back to the operating room as well. Back in the operating room, patients will gently drift off to sleep. Once the patients are asleep, we'll begin the procedure, get everything set up. Once we're completed, the patients will subsequently wake up. You will wake up and probably have a little tenderness. However, we'll have medications for that. And then anesthesia will take you over to the recovery unit. At that point, I'll generally go talk to the family members, give them updates. And unfortunately, for the patients, we can try to talk to them at that point, but it's very difficult for them to remember much of what we say. So we rely on family members to provide that information. Then we will have you make sure you're awake, make sure you can go to the bathroom. We'll have you go ahead and give a urine sample, make sure that's clear, tolerate a little bit of food, go over paperwork that gives you a little bit more detail about the recovery, and let patients go home. For patients that do spend the night, a lot of that process will just be delayed a little bit. We'll keep you overnight, make sure you're comfortable, get something to eat. By the following morning, almost everybody is ready to go home. It's normal to feel nervous prior to a surgery. So that's one thing that we just take into consideration, is that it's not unusual. It doesn't mean that there's anything atypical going on. I think for most patients, the real key is to know that we're in this with you. We are here to make sure you get the best patient outcome possible, that we meet the desires of what we're looking for going into doing any sort of procedure. And not only that, that we're there to help answer questions and help take care of you after the procedure. I do encourage patients to make sure that they do get their questions answered before surgery, whether that's the day of or leading up to surgery. Feel free to get in touch with us via MyChart or give us a phone call so we can make sure everybody's on the same page and that you feel like you've been given ample opportunity to ask any questions or have addressed any concerns that you may have. If questions come up before surgery, please reach out to myself, our staff in the office, or shoot a message through MyChart. MyChart's the system that it will function similar to email, that patients are able to get in touch with us and leave a message. Sometimes that'll actually be a little bit easier than even trying a phone call. But please do reach out. Oftentimes my staff have seen plenty of this and are able to answer the questions you may have. But if they feel uncomfortable or don't know the answer, they're going to be sure to be in touch with me so we can make sure to get you the answers you need prior to getting to the day of surgery.